There are 7 foods that, when eaten consistently after the age of 60, can lower your blood pressure without a single new prescription, and most people have never been told why they work the way they do. I am Dr. James Fontaine, and after more than 20 years of managing blood pressure in patients well past 60, I have learned that the foods that matter most are almost never the ones people expect. Today, I want to walk you through all 7, explain the actual mechanism behind each one, and tell you exactly how much you need and how often, because vague advice like eat more vegetables has never lowered anyone's blood pressure. Specifics do. Before I get into the list, I want to explain something about why age 60 is such an important turning point for this conversation. As we get older, our blood vessels naturally lose some of their elasticity, a process called arterial stiffening. Stiffer arteries mean your heart has to generate more pressure to push blood through them, which is one of the biggest reasons blood pressure tends to climb steadily after 60, even in people who have not changed their diet or their weight. The foods I'm about to describe do not work by some vague general health mechanism. Each one directly counteracts arterial stiffening or directly supports your blood vessels' ability to relax, and that is exactly why they matter so much more now than they did when you were 40. The first food is beets, and specifically beet juice or roasted beets eaten several times a week. Beets are exceptionally high in dietary nitrates, which your body converts into nitric oxide, the same molecule I mentioned that allows your blood vessels to relax and widen. Multiple clinical studies have measured blood pressure drops of 5 to 10 points systolic within just a few hours of drinking beet juice, and the effect becomes more pronounced with regular use. I typically recommend a half cup of roasted beets or a small glass of beet juice 4 to 5 times a week, and I ask patients to track their readings for 2 weeks to see the effect for themselves, because seeing your own numbers respond is far more motivating than anything I can tell you. The second food is fatty fish, specifically salmon, mackerel, and sardines, eaten at least twice a week. The omega-3 fatty acids in these fish, EPA and DHA specifically, reduce inflammation in the blood vessel walls and have been shown to modestly reduce both systolic and diastolic pressure over 8 to 12 weeks of consistent intake. What I find most patients get wrong is thinking a fish oil supplement is just as good as the actual fish. The research is far more consistent for whole fish than for supplements, likely because fish also provides potassium and other compounds that work alongside the omega-3s rather than in isolation. The third food is plain, unsalted pistachios, and I know this surprises people every time I mention it because pistachios get lumped in with all nuts as simply a healthy fat source. But pistachios specifically have been studied for their effect on vascular resistance, meaning how hard your blood vessels resist blood flow, and the data shows a meaningful reduction in that resistance with a small daily handful, about 1 ounce, roughly 49 pistachios. They are high in potassium and arginine, an amino acid your body uses to produce that same nitric oxide I keep coming back to, because it really is the central mechanism behind almost everything on this list. The fourth food is Greek yogurt, plain and unsweetened, and this one works through an entirely different pathway than the first 3. Greek yogurt is rich in both calcium and probiotics, and research has connected regular yogurt intake with lower blood pressure, particularly in people over 60, likely because of its effect on gut bacteria that influence inflammation throughout the body, including inflammation in your blood vessel walls. I recommend about 1 cup daily, plain, with no added sugar, because sweetened yogurt brings back the exact sugar-related mechanisms that work against everything we are trying to accomplish here. The fifth food is garlic, and specifically aged or crushed raw garlic, rather than the garlic powder most people have in their spice cabinet. Crushing raw garlic and letting it sit for about 10 minutes before cooking activates an enzyme reaction that produces allicin, the primary active compound responsible for garlic's blood pressure lowering effect. Allicin has a mild vasodilating effect, meaning it helps blood vessels widen, similar in direction to nitric oxide but through a different chemical pathway. Studies using aged garlic extract have shown reductions of around 10 points systolic in patients with elevated blood pressure, which is a meaningful effect for something this inexpensive and accessible. The sixth food is leafy greens, specifically spinach, arugula, and Swiss chard, and I am listing these separately from beets because while beets get the credit for nitrates, leafy greens are actually one of the richest dietary sources of nitrates available, often even higher concentration than beets depending on preparation. They are also loaded with potassium and magnesium, both of which play a direct role in relaxing the smooth muscle in your blood vessel walls. I recommend at least one substantial serving daily, and I tell patients that a large salad or a cooked side of greens with dinner is one of the single highest impact changes they can make. The seventh food is dark chocolate, at least 70% cacao, and I include this one specifically because patients are always relieved to hear it. The flavanols in dark chocolate have a measurable effect on endothelial function, the same blood vessel lining I discussed in an earlier video, improving its ability to produce nitric oxide and relax properly. The effective amount is small, about 1 to 1.5 ounces a few times a week, and I am careful to specify 70% cacao or higher because milk chocolate and lower cacao percentages contain far less of the actual flavanol compounds responsible for the effect, along with much more sugar working against you. Now here is the part I think matters more than the list itself. None of these 7 foods work as a single miracle fix eaten once. Every mechanism I described, nitric oxide production, reduced vascular resistance, improved endothelial function, reduced inflammation, all of these require consistency over weeks, not days. I tell my patients to think of it less like taking a pill and more like a savings account. Every time you eat one of these foods, you are making a small deposit toward your blood vessel's ability to relax and widen properly. Miss a few days and nothing bad happens, but skip it entirely for months, and you are simply leaving that benefit on the table while your arteries continue stiffening on their own timeline. I want to share a story that illustrates this well. A patient of mine, a woman named Carol, 72 years old, had been on 2 blood pressure medications for nearly a decade, with readings that hovered stubbornly around 145/90. We did not remove either medication. What we did was build a simple daily pattern: a small glass of beet juice in the morning, a handful of pistachios as her afternoon snack, and a large spinach salad with dinner at least 5 nights a week. Nothing dramatic, nothing that required her to give up meals she loved. Over 10 weeks, her readings settled into the 120 to 130 range consistently, and her cardiologist reduced one of her 2 medications. She still tells me it did not feel like a diet. It felt like she just started adding a few specific things to what she was already eating. I also want to address something practical because I know some of you are thinking about cost and convenience right now. You do not need all 7 of these every single day. If you can only realistically commit to 2 or 3, I would prioritize the leafy greens and the beets first, because the nitrate pathway has the strongest and most consistently measured effect in the research, followed by the pistachios and garlic, which are inexpensive and easy to incorporate into meals you are already making. Build from there as it becomes routine, rather than trying to overhaul every meal starting tomorrow, because the changes that last are the ones that fit into a life you actually want to keep living, not a temporary program you abandon in 3 weeks. If there is one thing I want you to remember from everything I have shared today, it is that your blood vessels are not fixed in stone, even after 60. They respond, they adapt, and they heal to a remarkable degree when you give them consistent support, meal after meal, week after week. These 7 foods are not a cure, and they are not a replacement for medication your doctor has prescribed, but they are one of the most powerful additions I have seen in my career for helping patients get their numbers into a range that feels safe again without adding another pill to the list. I also want to spend a moment on the foods that are often marketed as blood pressure friendly but do not actually hold up when you look closely at the research, because I think this matters just as much as knowing what does work. Celery is one of the most commonly repeated recommendations online based on a compound called phthalides that has shown some vasodilating effect in animal studies, but the amount of celery required to reach an equivalent human dose is genuinely impractical, something like 4 stalks eaten multiple times a day, and the actual clinical evidence in humans remains thin. I'm not telling you to avoid celery. It is a perfectly healthy food. I'm simply telling you not to expect it to move your numbers the way beets or leafy greens will. Similarly, coconut water gets marketed heavily for its potassium content, and while it does contain potassium, you get significantly more potassium per calorie and per dollar from a baked potato with the skin on, or from the leafy greens I already mentioned, without the added sugar that many bottled coconut waters contain. I bring this up because I want you spending your effort and your grocery budget on the things that actually move the needle, not on whatever happens to be trending. The 7 foods I outlined today are not trendy. They are the ones that show up again and again in the actual clinical literature on blood pressure and aging, and that consistency is exactly why I built my own recommendations around them rather than whatever new superfood gets popularized every few months. I also want to address timing, because patients ask me constantly whether it matters when during the day they eat these foods. For the nitrate-rich foods, beets and leafy greens specifically, there is some evidence that the nitric oxide boosting effect is most pronounced in the hours immediately following intake, which is why many patients find it useful to eat their beets or their salad earlier in the day if they tend to see their blood pressure readings climb in the afternoon or evening. For the others, pistachios, yogurt, garlic, dark chocolate, and fatty fish, the timing matters far less than the consistency. What your blood vessels respond to over weeks is the cumulative pattern, not any single well-timed meal. One last point I want to make, because I think it gets overlooked in almost every conversation about diet and blood pressure. These 7 foods work best not as an addition stacked on top of a diet that is otherwise working against you, but as a genuine replacement for the foods that are actively harming your vascular function. If you add a handful of pistachios to your afternoon but continue eating processed deli meat and fried food at every other meal, you will see a much smaller effect than if that same handful of pistachios replaces a bag of chips. The 7 foods are powerful, but they are working against a headwind if the rest of your diet is still stacked with the sodium, sugar, and oxidized fats that damage your blood vessel lining in the first place. Pair this list with genuinely cutting back on processed and fried foods, even modestly, and the combined effect is far greater than either change made in isolation. Let me also share how I typically suggest patients build this into a real week, because a list of 7 foods can feel overwhelming until you see it laid out simply. Monday and Thursday, a small glass of beet juice with breakfast. Every day, a large serving of leafy greens with dinner, rotating between spinach, arugula, and Swiss chard so it does not feel repetitive. An afternoon handful of pistachios in place of whatever processed snack used to fill that slot, salmon or sardines twice a week in place of red meat or processed meat at dinner, plain Greek yogurt most mornings instead of sweetened cereal, crushed garlic worked into 2 or 3 dinners a week, which is easier than it sounds once it becomes a habit in how you cook, and a small square of dark chocolate a few evenings a week, which patients consistently tell me is their favorite part of the entire plan. Laid out this way, none of it feels like a restriction. It feels like a rotation of foods you already enjoy, arranged with intention instead of at random. I want to close with something I tell every patient in this age group, because I think it applies far beyond just blood pressure. The body does not stop responding to good inputs after 60. That belief that meaningful change becomes impossible once you pass a certain age is one of the most damaging misconceptions I encounter in my practice, and it is simply not supported by what I see in exam rooms every week. Vascular tissue remains remarkably responsive to diet at 70, at 80, even beyond. The 7 foods on this list are proof of that responsiveness, measurable, repeatable, and available to you starting with your very next meal. Start with 1 or 2 of these tomorrow. Track your numbers for a few weeks. And watch what your body does when you finally give it what it has been asking for all along. If this video helped you, I would love to know a little about who is watching. Comment below and tell me what city you are watching from, or simply tell me your age. I rate every one of them, and it helps me know who I am actually talking to when I sit down to make these videos. Subscribe for more of these honest conversations about the heart and everything that quietly shapes it, and share this with someone whose blood pressure could use this information. This is Dr. James Fontaine. Take care of that heart of yours, and I will see you in the next one.